Hi everybody, it's Jenny Sprung, treatyourselfnaturally.com. The idea is to give you tools and resources so that you can take care of some of your own pain. We're going to talk about tennis elbow, golfer's elbow, wrist pain, carpal tunnel, and we're going to show you what has worked for us and what has worked for my patients. I'm a neuromuscular therapist, a neurosomatic therapist. I am a zero balancer. I have been treating people for a long time and just want to share some of the successes that we've had with self-treatment. So, if you have pain from using the computer or from driving or handheld small computers and phones, there are some tools that you can use, and you'll find all of the tool references and guides on my website. This is triggerpoint.com. This is a lacrosse ball. These are from Fitness Wholesale. They're TheraBands, and this is a dryer ball, and this is another similar piece in the TheraBand kit from Fitness Wholesaler. So you'll see all of that on my website. Let's say my right hand hurts from massaging, from working on people all the time. You're going to want to, and this is just like a cookie dough roller. So if you've got a cookie dough roller at home, see if you can put a cloth on it, make it a little softer. You don't have to purchase one of these. The idea is that you use all of these tools and tips safely and check with your physician first. We're just giving you our subjective view on what has worked for many around us. So palm up, you're going to put your hand on your other hand and just do the dorsal side of your hand. So all of the extensors of the fingers. And work that, work into the wrist. And you can just roll it like this, and that will feel good, but putting a little weight on it really assists in getting some of those trigger points, particularly in the wrist. You can also roll all the way down into the forearm. A little bit of rotation is needed. Those people who can't sit on the floor and can't stand, who might be wheelchair bound or seated always, find a table and work there. This will make you feel much better all the way around. So all of these deep layers, there's 3 layers to the forearm, all of these deep layers attach around the humerus, around the ulna, and the radius. So you can release elbow pain, forearm pain, wrist pain by taking a few minutes, a few times a week. So how long? Maybe 5 minutes. You don't want to overdo it. We found that folks really get excited about foam rollers and then they do too much and they create pain. This is supposed to be therapeutic, so you're going to find a spot right there. Take a couple of breaths. Wait 8 to 12 seconds. And let it release. Nice. And you can go ahead and karate chop position and go ahead and get right into the ulna, the pinky side. Once again, you'll see how I'm giving a little pressure with the other hand, and I'm going all the way up to the elbow, right in the elbow. So I'm going along the fibers of the muscle, so I'm going long, but you can also roll the hand this way and roll the bones right over. To get to the palmar side, so this is pretty easy to do, but when you come here, you might have to do a little bit of a lean over to one leg so that you can really get into the flexors, the muscles of the forearm. So this part, the thumb side, is difficult to get. You can roll it and warm it this way, and this is actually a form of myofascial release, warming the tissues. Another piece is just to release the carpals of the hand. So all through here, just delicious, really good for you, and it feels really wonderful. And just push down and roll it out. Find a spot that's sore, and generally it's going to be pretty darn sore right around here at the thumb, and also around the base of the pinky down, all the way through just above the wrist, or anatomically is going to be below. So you can also roll it with the other hand. This creates more weight on the rolling portion, and then go into the metacarpals, which is all of this, and you can even do the fingers, the phalanges. If you have a finger that's stiff or swollen, nice deep breath. So again, how long? Not long, 8 to 12 seconds. When you find a sore spot, breathing and thinking therapy, therapeutic, and breath. So once again, you can use any of these from triggerpoint.com. Everybody's made differently, so sometimes some folks have really big forearms, and some people have really very petite forearms. Some folks have experienced breaks. This is going to release all of the soft tissue connection to the bone. And quite therapeutic. Right in here, particularly for what people are diagnosed with carpal tunnel. If you're wearing one of those braces, we have found, my research team and myself have found that these therapeutic home treatments can reduce pain, reduce inflammation, increase range of motion, and make you smile. Thank you very much, and stay tuned for the lower leg.